Oh, I keep saying this. Good morning. I'm a little bit under the weather today. Good afternoon. I am Dr. Pierre, your favorite board certified internist, founder of drpierreblog.com, author, speaker, soon-to-be podcaster. And just a quick note on the author standpoint, my book, our Medical Moguls book, I think I showed it last week or over on the Snapchat or Facebook. Our Medical Mogul book will be officially going on sale tomorrow afternoon. I'll definitely give you more details tonight, when that comes about. But, I'm very excited about that. I'm ready to become a bestseller. If you've been following me since December, you knew one of my affirmations that I wanted to do in 2017 was become not only an author, but become a bestseller, because, hey, there's no point to shoot if you're not going to shoot all the way. So tomorrow, hey, Amanda, thank you for hearing. Tomorrow, we're looking for becoming a bestseller. I'm excited about that. 12 to, was it 12? Oh, no, sorry. I keep saying tomorrow. I think it's Tuesday. I'll get the right date. I'm a little bit under the weather today, so my dates are wrong. But no, it is Tuesday. We'll get all the information for you. You guys will make me a bestseller when that time comes about. Just very excited about that. So again, you got to apologize again. I am a little bit under the weather today. I think one of my twins got me sick. And if you're a parent, you kind of understand what that cycle goes about. Your child gets sick, and you just almost kind of count the days when like, oh, hey, Dr. Dre, thank you for joining. You just count the days when you're about to get sick as well. So I'm a little bit under the weather. My wife has it as well. I think we both got the upper respiratory, sinus, everything's not doing well. Today's video is sponsored by Walgreens. I got cough drops. I've been popping them left and right from that standpoint, trying to avoid antibiotics if I can. Hopefully I don't have to go that route. But today is Lunch and Learn. Today is episode 35, right? And today's an important one, right? Today, I think we're kind of following the theme of the Momentum in Medicine Conference, Medical Mogul, and kind of asserting yourself in this place in healthcare. And a common question, I definitely will, Amanda. A common question I ask is like, what's the problem, right? What is the real problem with healthcare, right? And a lot of times it depends on who you ask, right? If you ask doctors, they'll tell you one thing. If you ask patients, they'll tell you another thing. If you ask, a lot of the businesses, surrounded around medicine, and I mean like hospitals, nursing facilities, and all of these kind of, one-off things that really are supported by healthcare and everything that kind of healthcare kind of entwines. Everyone seems to have a different issue, right? What the problem. Oh, Sharon, hey, thank you for joining. Appreciate that. Everyone seems to have a different issue, right? Of what the big root cause is. But at the end, right, from a common theme that I've seemed to notice, and again, I think I get a lot of this dealing with the fact that I do have a master's in public health, and my my master's thesis was actually on program evaluation. And I've learned very quickly, like, one of the biggest fallacies, especially when we're talking about outpatient medicine, inpatient medicine, rehab, is, and if you had this name one thing, right, what's the worst thing about healthcare, the healthcare system today? And the reason why we're having the problems that we're having is comfort, right? And healthcare, right, is at a level of comfort that I can't even explain. I can't even explain the level of comfort that healthcare as a total is, and like, it's almost mind-boggling, right? Because healthcare, again, is probably one of the most inefficiently run businesses like around. Like, if we ran healthcare, the way if we ran Google the way we run healthcare, if we ran Apple, we'd be out of business quick, fast, in a hurry, right? So the big thing, in fact, I'll put it on. I'll put it down there. Somebody, if you write in the comments, comfort is the biggest problem in healthcare today, right? And today we're going to talk about. Sure. Oh, thank you for joining. Thank you. Hey, Marie, thank you for joining. So when we talk about comfort, and when I say comfort, I'm gonna talk about it from a couple of different perspectives. I'm gonna talk about it from the perspective of the physician. I think from a physician standpoint, one of the biggest things that I see, right, is that we become comfortable, right, in a system that unfortunately does not treat us fairly. We've become comfortable in a system where we get penalized, right, for taking care of the sickest patients, right? We get penalized for not seeing as many patients as we want to see, right? And what I mean that is that, like, the way our system, works, especially from a payment system, because of course that's what a lot of people are focused on. Our system is based on like how much of stuff we do, right? It's not based on how well we do it, right? So think about that logic, right? Like, imagine if Apple, the only way Apple was based on was how many iPods they dropped, right? Not the fact that the iPods worked or not. They're just the sheer number of iPods that drops. Like, that's how, like, imagine that's how healthcare is right now, right? So from a business standpoint, like, take me, the physician, I'm a business standpoint, I don't have an incentive, right, to sit there and talk with my patients like I do. I don't have an incentive to sit there and get to know my patients like I do. Why? Because the incentive that's been, dabbled in front of me is that I got to get to that next patient so I can build that next patient, right? So we're, and for a lot of us are, unfortunately, are very comfortable with that, right? That's kind of where we're at now. We're comfortable with the fact that if I don't see more patients, if I don't do more procedures, I don't get paid more. And so who gets left in this? Like, so again, medicine, like, and I know we don't like to talk about it in that sense, but the patient, right, is our customer. The patient is the customer. The patient is the product. And right now we're in a system where we don't really take care of the product like we do, right? We're comfortable, right? We're comfortable with double booking. We're comfortable with your appointment's at 9 o'clock. I'm not seeing you until about 10:30. We're comfortable with getting you in and out before you even had a chance to ask you all your questions. And that's tough, right? Because some of my patients, I got patients who got to pay like $75, $100 just to see a doctor, right? So imagine you got to pay $75, $100 just to see a physician, and they're getting you out in like 5 minutes. 5 minutes, boom, boom, boom. They don't even answer all your questions, and you're already out the door. That's a problem, right? And right now there's this level of content, right? Where we're just like, okay, that's just how the system goes, right? We're just like okay with that type of motion, right? And that's where becoming, the medical mogul that I'm at right now, you're not going to be able to be comfortable with that, right? You're not going to be able to, continue to walk in that type of light and feel good about it. And that's really, again, I talk, right, like I'm some person who's been around the block for 50 years. No, I just graduated, with degrees in the back. I just graduated 3 years ago, 3 years and some change, right? But I noticed very quickly, I was like, this is not good. This is not efficient, and this just doesn't help the patient, right? So that's from a physician standpoint, right? Now let's talk about my patients, right? Because of course, I'm an equal opportunist when I'm talking about the good and bad things that our profession does, right? So we got to talk about our patients, right? We have a lot of patients, unfortunately, are very comfortable, right? Very comfortable, not following the directions of those who went to school for 3, 4, 8, 12. Like, we got a lot of people who are very comfortable with not doing that. We got a lot of patients who are very comfortable with, even if they go to see that doctor and they see them, they talk to them for 15, 20 minutes, say, you know what, I heard what he said, I'm okay on that. I'm not going to do that, right? And kind of doing their own thing. And this is even when we factor in like cost of medicine like that I understand. Trust me, as a public health professional, I'm 100% aware, right, of the limitations you may have the second you leave out my door. I got patients who, when they come see me, they got to go, they catch a bus to see me. So I'm well aware of financial restraints, right? But I'm not talking about those patients, right? I'm talking about patients who are, unfortunately, willfully non-compliant, right? Because again, remember when I talked about our system where, as a physician, right, my incentive, right, isn't to treat the most sick patient, the patients who really need it. My incentive is to see more and more and more patients. Hey, Jessica, thanks for joining. So we're in this like back and forth, right? Like, yeah, I want to take care of all of the sick patients. I want to do that. But a lot of those sick patients are unfortunately sick patients because, they're just like, you know what? I'm just going to do what I do. I know I'm a diabetic, but I'm just going to keep eating the way I want to eat. I know I'm a hypertensive patient, but I'm not going to take my medications. I know I have high cholesterol. I'm still going to eat fatty food, right? And so imagine on the other side, right? Imagine you're on that side of the table, right? And me and you both know, right? We got medical problems that we're trying to take care of. But the second you leave my door, you're like, yeah, I'm okay. I'm good on that. Or even worse, my knowledge, my medical knowledge, whatever it is, usually gets second place to something you read online. Happens all the time. First of all, and full disclosure, I actually have no problem with that. I actually like my patients who are a little bit more in tune with their medical disease. I actually want you to be, because I like to have those patients who see me, patients who are in my office, they know I like to have a little back and forth. So if you're going to teach me something new about, keto diet, paleo diet, I love to hear it. But, if we get to a point where like, yeah, I say, yeah, I think you should do this and this is the best way. And then you leave and say, yeah, you know what? Someone on Google, some blog or read, some nutrition, somebody said something different, and I'm going to listen to them. I'm in a lose-lose situation, right? So the problem is, right, and then especially if you haven't been paying attention with all of the stuff that's happening in healthcare, right? The biggest problem, right? I can tell you right now, the biggest losers in this situation is going to be the patients, right? Because if they even come up with some type of system, right? Even if they come up with some type of system that talks about, and if you have certain amount of disease, we're going to put you in this risk pool of patients. You know what's going to happen? I remember I talked about how physicians get paid, right? What's going to happen is that you're going to have physicians just not see them because they say, you know what, every time I got to go see, patient A over here, it takes me 30 minutes to go see them. We got to go through all of the medication, all of the diseases. Whereas I can see person B who's healthy, so I may be able to see in like 5-10 minutes, and I can see more of patient B, right? So this is what's concerning when I see all of these like these proposed healthcare plans, which most likely is not going to pass. I mean, because they're crazy, but that's a whole nother discussion. But whenever you hear us, like people suggest that, put them in a risk pool, put them in a risk pool, like it's good and dandy to put them in a risk pool, right? But who's going to see them? I work for a corporation. I can tell you right now, they're not going to jump into that pool to see all of those respiratory patients because the business of medicine says it makes no sense for me to do it if I get paid for seeing more patients over here. If I get paid for seeing more patients, I'm not going to go in that direction. So we just got to, especially in healthcare, man, we just got to get to a point where like we just stop being comfortable with the way things are. Because fortunately, the way things are not going well, right? The way things are not going well for the physician. The way things are not doing well for the patient as well. And we can't allow ourselves to just be comfortable with the fact that this is just how things go, right? We can't be comfortable with that. Like, there's a reason why the United States is behind on so many health markers compared to other industrialized nations around the world. There's a reason why, right? Because in the United States, we're just we're so comfortable in how we're doing things right now that there's no catalyst for change, right? There's no catalyst to kind of make you move forward. So when I was at the end of December, when I started this medical mogul endeavor, this journey, it was because I really was uncomfortable with where I was at, and I realized at a very young age in my medical career, right? Like, there's absolutely no way that I would be able to continue doing like this, right? So I made the leap, right? So again, next week we talked about a book coming out. I'm going to be doing more speaking. I'm going to do all of these things here. Again, want to really just kind of separate myself and to really use my medical degree to its fullest extent, right? Like, I didn't go to school. I didn't go to 4 years of undergrad, 4 years of medical school, 3 years of internal medicine residency. I didn't do all of that schooling, right, to just be pigeonholed in one box, right? I became uncomfortable, right? And you don't start really making moves until you're uncomfortable, right? For my patients who are, me, and for those who know me, like we're on this journey, like I'm trying to lose some weight, right? When I came out of residency, I was 325, right? Like 325. And I jump out of residency, I'm in the outpatients, and I'm telling my patients, you gotta lose weight, right? So of course they're like you telling me to lose weight, but you're fat too, Dr. Pierre. So I had to make a change, right? I had to be uncomfortable in the position because I was comfortable. Clearly I was comfortable during residency so much that I was eating whatever I wanted to eat. Even though I had to hypocritically tell patients don't eat this, even though I was hypocritically telling patients, don't do this, I was doing it myself. So it was a leap I had to make because I was uncomfortable in my situation. So as a patient, you have to be uncomfortable as well. You can't be okay, right, with having to be on so much medication, especially if you don't need it, right? You can't be okay with always having to, be not in the best state of health, right, because of actions that we we kind of take on for ourselves, right? You can't be okay with that. And I think once we break out of our comfort zone, once we make things uncomfortable, like for my patients out there, so I want you guys you should make things uncomfortable for your doctor, right? Your doctor should not be able, especially if stuff is going wrong, right? Stuff is going on, and you're not at the best of your ability. Your doctor should be very uncomfortable when they walk in that room, right? Because they should know that, all right, I'm about to hit them with a brick of information, right? And because again, at the end of the day, we're here, right? And as a physician, right, you need to be able to make your patients comfortable as well. Me, I got no problem telling you, you need to stop smoking, right? I got no problem telling, again, this is when I was like 3-something, right? I got no problem telling you need to lose weight, right? Because I had no problem looking in your eye and be like, no. If you don't do anything right now, this is going to be a problem. And that's where we got to be at, right? We got to be at a point where, because again, if like we talked about comfort, comfort is a terrible thing, especially in Medicare, right? And we're not rocking over here like we're Apple or Google. We're not doing that. Again, look. I wish I wish I had the numbers. Sorry, wish I had the numbers. Like we're from a health market standpoint, we're in the bottom to like last, and like especially when you talk about civilized nations, we're like in the bottom half of almost every single thing you kind of think about, right? So there's no reason why someone in the United States, especially in the healthcare system, should be okay with where they're at and should be okay with what they're doing, right? Yes, make your appointment for us. So that's kind of where I'm at now, right? I wanted to kind of like blur that out. I wanted to kind of say it because I just felt it in my spirit, right? I just felt in my spirit that, hey, I gotta tell these patients, I gotta tell my people, I gotta tell my followers, we gotta do something different, right? Because it's not all good. It's not all good right now, and perfect. Oh, I'm gonna get to your point, man. We gotta be okay, right, with being uncomfortable. We, as a physician, all my physician friends who follow me, all my people who follow, share this. We gotta be okay with making our patients uncomfortable too, right? If you see your patient, that diabetic patient, is coming back and their A1C still ain't controlled, you gotta let them know, like, hey, you don't want to be controlled, I'm gonna let somebody else take care of it because I'm not gonna deal with this. I've already told you all of the problems that diabetes could cause. And you can follow. I'm pretty sure I have a blog on diabetes somewhere. I'll put a link on it. I can tell you all the problems that diabetes has, but if you don't do anything about your diabetes, we're gonna have some problems, right? Diabetes, hypertension, high cholesterol, heart disease. If you cannot be comfortable with these labels like attached to your name, right? Like you should not be comfortable, right? You should be working every day, right, to try to change that. And that's really my goal, right? That's really my goal, just kind of moving forward. That's really my goal, with all of the stuff that I'm doing in the now and the future, with trying to just kind of move us forward to a place where we should be comfortable, right? Like, again, I want us to be comfortable. But I just, in my heart, know that at this point, like it's fool's gold right now if we are, right? You shouldn't be either, right? So that, again, the theme of the day, if we take one thing from today's video, right, is Dr. Barry does not want you to be comfortable, right? If you are comfortable in your position and you should not, then that's a problem, right? So we got to get uncomfortable, right? Because if we get uncomfortable, then you'll move forward. If I don't, like my coach is on the video, Dr. Dre Birch, like he makes his people uncomfortable all the time, right? And because he knows if you're relaxed, if you're okay, you're not going to move anywhere, right? So he made me uncomfortable 6 months ago, 7 months ago, whatever that time frame was, and here I am today. I appreciate all that. So again, that's my goal, right? Because again, there's no point for me to like absorb all the knowledge, right? If I don't turn around and give it to everyone who's watching, reading, listening soon, especially when the podcast come out, who'll be listening to me. If I don't do that, doing everybody a disservice, right? So again, I'm gonna. All right, so I'm about to head out. First of all, I want to appreciate everyone for following. All of my replay viewers, appreciate you. Remember, like, share. Remember, if you go to my website, you can see how to join my Health Squad email list. You'll see how to join my private Facebook group. Go to drpiersblog.com. It'll be right across the top. You can't even miss it. I expect to see everyone, if you're not already signed up, to be signed up today. So again, once you leave here, drpiersblog.com, call it a day. Again, the word is comfortable, and that's an evil word, right? So from now on, when you hear the word comfortable, you should think bad things, right? Especially when we talk about healthcare. If you're comfortable in healthcare, there's a problem, right? So that's where I want to get you to. So I'm gonna see you guys tomorrow. Tomorrow I'm actually writing a blog, very important blog. Got some big news dropping tomorrow, so I want you to definitely read that blog post. Very, very, very big news. Excited about it from that standpoint. I think the title, let me see. When Becoming a Medical Mogul Was a Life or Death Decision. So very, very great read in my standpoint. And we'll talk about what it took me 6, 7, I'm not even sure what time it was, 6, 7 months ago to get to, where I'm at, where I'm at today. And sorry, where I'm at today and where we want to get to. Like I said, I apologize. One of my twins got me sick, so I've been popping halls and sinus medication all day. Hopefully we'll be better by the weekend. That's how it usually goes about. So I'll see you guys tomorrow on the blog. If you're in my private Facebook group, I'm going to try to do a live stream later today to kind of give you an early present of what the news will be tomorrow, but very big news. We're excited about that. So I'm going to see you guys tomorrow on the blog, and then next week for our Lunch and Learn. Haven't decided what the topic is, but you know how we usually do. We'll get something out there. So I'm going to see you guys later. Bye.